Ladies and gentlemen, this is the public service announcement time for the St. James Education Foundation. A few things that I'd like you to know about the foundation. We are investing in the future. So when it comes to our role in the community, we do two things. We empower our students, and we do that at St. James School by ensuring that they get to go on field trips. We've funded the Spanish at St. James that's been going on now for 2 years. We have the music program, the hands-on art, and I'm very proud to say that this year the foundation, with the help of Anita Crady, has introduced hands-on science at St. James School as well. In addition to that, we educate our community. So this 4-part speaker series that we've first started for the first time this year is an attempt at spreading awareness on various community-related topics, the need for which you drive. And so please, your feedback is extremely important to us. Our website is the acronym for the St. James School Education Foundation.org, and you'll find that on those pieces of paper. Our next speaker is Ms. Gloria Noell, and she is the Director of Case Management at the Providence Little Company of Mary. Gloria has a tremendous amount of experience in case and care management. She is also part of the Speaker Bureau, which is part of Little Company of Mary, and does community outreach by educating families on health-related matters. Ladies and gentlemen, please welcome Ms. Gloria Noell.
Good morning, everybody. I just wanted to thank everybody that is attending this morning. We're just thrilled that we have so many people here. Can you hear me? No. Okay, can you hear me now? There you go. Okay. So I'm the Director of Care Management at Little Company of Mary. I've been doing basically case coordination and assisting with transitions and overseeing people that do transitions in care. And some of that care involves end-of-life care. So that's what we're going to talk about today, is planning for your care. So we're going to talk about how to have a safe, successful healthcare stay at the hospital. You know, whether you're admitted through the emergency room or through for elective procedure, it's always good to have a plan in place before you end up going into the hospital. A lot of patients come into the hospital and, you know, they have no advance directives in place. There's also a pulse form for people that are very fragile and elderly that can be filled out by the patient's primary care doctor. So that's also available. But a lot of patients don't have an advance directive. They don't have anybody designated as the person to make decisions for them. So there ends up being a lot of conflict amongst the family members at times because there hasn't been anybody designated. So, you know, hospitalization can be an overwhelming experience for you as a patient and also for your family. You know, first and foremost, don't forget to talk to your doctor. And, you know, you're a part of the healthcare team. You know, whether you think of yourself that way or not, you're the most important person on the healthcare team because you are the patient. So, you know, we need to be communicating with you, and we need to know that you're understanding, you know, what we're trying to do. You need to know what medications you're on. You need to know what the plan is, and you need to know your diagnosis. You know, if you're coming in through the emergency room, you may initially come in and they may not know what's going on with you, and you may be a rule out. But you need to know by the time you transition out of the hospital that, you know, what your diagnosis is. So, and then your team in the hospital is composed of nurses, doctors, care management people, and then palliative care team may be involved in your care. Palliative care is a program that's a bridge between hospice. It's a bridge basically to hospice. You may be able to qualify for palliative care services and maybe be on palliative care, you know, a number of years before you even need hospice care. We have a very active palliative care program at our hospital. And we have 2 physicians that see our patients. And unfortunately, a lot of these patients don't get referred to our palliative care team until, they're very close to death. And, for our team to be more effective in working with you and helping you plan for the future, we are asking the physicians to go ahead and refer the patients earlier. At Providence, we are in the process of opening up outpatient palliative care so that people can be followed in an outpatient setting in conjunction with their doctors. People who would qualify for palliative care would be people with chronic illnesses. That maybe they might be end-stage renal disease, end-stage CHF. Anybody that has a chronic diagnosis would qualify for palliative care. Palliative care doesn't mean that we're not going to treat you. It means that you're basically going to receive conservative treatment, and it may be that you don't want extensive treatment done. There's a lot of collaboration with the patient. There's a social worker that's usually on the team, and a case manager. Usually there are nurse practitioners, and there may be someone that can come see you in the home that's a palliative care person. So, when you're coming into the hospital, it's important to prepare for your stay. So, you need to know why you're being hospitalized, what your diagnosis is, or your family member's diagnosis, and then who do you want to make the decisions for you? We need to know ahead of time so there's not so much confusion. It's very important for us to have somebody to talk to that can advocate for you. We see a lot of unbefriended patients in the hospital that have nobody to speak for them, nobody's been designated. And so then their friends will come in and want to speak for them, but that's not really helpful to us. We really want to hear from you and what your wishes are. The best way to do that is to communicate with your primary care doctor. The primary care doctors are at this point in time required to talk to you about end-of-life care planning. If they're not doing that, you might want to bring that subject up with your doctor. A lot of the doctors shy away from these conversations. They're just, their goal is to really treat you and aggressive treatment. But a lot of patients may decide that they don't want aggressive treatment. So again, you need to have these conversations with your physician. If you're coming into the hospital, make sure you bring in your advance directive. A lot of patients will say, well, I brought it in the last time. It's important to have your advance directive with you anytime you come in. Most of the hospitals are going to computerize medical records, but still, in order to be able to treat you the way you want to be treated, it's important to have that advance directive with you, or the pulse form when you come into the hospital. And especially if the person's coming in through the emergency room and you don't want the patient to be coded or to go through CPR, say that they would prefer not to have to go through that, it's important for the ED physicians to know that that's what your family member wanted. And so we need to see those advance directives. We're going to do a question and answer session at the end of this. While you're in the hospital, talk to your team about questions about the treatment plan. What you're wanting may not coincide with what the doctors want to do. I mean, we periodically have family members that don't want G-tubes put in their family member. They want the patient on comfort care, and the doctor may have already ordered a GI doctor to come in and put in a G-tube. So it's very important for you, as part of that team, to be having those conversations with the doctor and asking them, what's my plan of care? And if you're not clear on the plan of care, please talk to the nursing staff on the unit, the case manager, so that we can make sure that that information is clearly communicated to you and you're part of the team that makes the decision. because we don't want to be moving forward unless you've had time to think about your options and that you choose that that's what you want to do. While you're in the hospital, make sure that we have all your information about your insurance. For people that have Medicare, and I'm sure that a lot of people here do, it's really important to know what your admitting status is on your family member or yourself. A lot of patients that come into the hospital may be put into what's known as observation status. So when you're admitted to the hospital, make sure you ask your doctor, what is my admitting status? Because that changes the way that you're going to be billed. In observation, the stay is usually 24 to 48 hours. So you need to know this. And especially with, if you have a family member that is declining and they're coming back in frequently, it could be that they may put them in observation status with plans to transition them to the next level of care or maybe home on hospice. So you really need to be asking these questions